Basically, EMDR was created and first studied and researched most for individuals who have trauma in their history. So either somebody who has post-traumatic stress disorder or somebody who has a childhood trauma or a trauma in their life as an adult. And so EMDR works to heal that trauma within that individual. We've also learned that with EMDR you can utilize that in other populations, and so I use it a lot with clients who have eating disorders. I specialize in eating disorders, and so I use it a lot with that population. It's not as well researched in other populations, but there is a lot of evidence for EMDR with people who have anxiety disorders, people who have phobias, individuals who have had a recent trauma or a trauma way back in their life. And it can be either a trauma that is a large trauma, what we call a big T trauma, such as witnessing a car accident or having been molested, raped, or in some other way victimized, or it can be what we call a small T trauma, where somebody is exposed to, has an exposure to domestic violence or to chronic belittling. In some relationships, people are exposed to chronic belittling and or made fun of, things like that. So lesser traumas, but still upsetting in their own right.
So basically anybody who feels like they need therapy or would be helpful could go to an EMDR therapist. Mm-hmm. Is that correct?
Yes, and the therapist will be well trained enough to be able to discern whether or not EMDR is the appropriate technique or treatment for that individual.